All right. We now move on to another panel. This one's another exciting panel that we're going to have of leading experts. The one that we had before was on workforce. How do you get your workforce motivated for innovation? How do you get them excited about innovation? But a lot of innovation that we came forward with Martha and Andy and Aaron and Stacy is there's a partnership that's involved in this, and it really depends on bringing in big companies with big money, and it's amazing when a big company with a lot of cash comes in how fast things can move. Or Shark Tank when they invest in your company and you can take it to a new level. Today we have four wonderful panelists that are going to be here. We have Saurabh Bhatnagar, sorry. He's the Chief Medical Officer for United Healthcare. He also was the Chief Medical Officer within the VA, working on the original EHRM that we were doing, so there's some great experience there. He said you can blame him for everything that went wrong with that. He's the guy that wants to take credit for that because he's that kind of guy. We have Dr. Jay Bhatt, who's the principal of JDB Strategies, and they have been doing analytics and cross-sector initiatives with geriatrics. He is a provider as well. Jay, thank you for being here with us. We're going to get a little chance more to learn about some of the stuff you do. Teresa Jackson. Teresa waved everybody there. She is an Air Force nurse who has served as a veteran. She has served in Operation Enduring Freedom, Iraqi Freedom, 3 combat deployments, and she's now the Chief Medical Executive with AMVETS. So thank you for bringing that with that whole component. And then Jessica Davis, who's the Director of Government Programs with Microsoft. It's a small company most of us have never heard of. I'm not sure if you've seen it, but they've got something that deals with either shutters or window. What? Oh yeah, something about that. And gates, that was it. So anyway, we're going to talk about a few of these things that go on here. So when we talk about partnerships and we talk about innovation, it takes money, it takes time, it takes thought. So let me throw this over, first of all. So Saurabh, let me throw this to you first, because you were in that trench with the VA as the Chief Medical Officer there, where we now have John Wyndham and his team rolling out EHRM, and we just went live, by the way. I heard it was a great success, and they're doing well out there. John texted me last night and said, hey, Captain, we're doing great stuff. So in partnerships, how did you see partnerships coming in, whether it's with a Cerner or one of those big guys, or an IBM, a Microsoft, a GDIT, a Leidos, or maybe a small service-disabled veteran-owned company, an AMVET? How do you see those partnerships in the clinical side coming in for innovation?
Absolutely. And that's a great question, Joe. And thank you so much for having me. And definitely, we're on the heels of that Man Grant Staff VA launch with Cerner. So kudos to John Wyndham and kudos to Dr. Stone and the rest of the team for getting that successful launch out there just this past week. And it's an exciting time. And I'd say the partnerships that you mentioned, that collaboration is critically important to the work. And it was critically important to the work at the VA. What many folks don't realize, the VA is not only an amazing healthcare agency for veterans, but it's also the backbone of a lot of the emergency preparedness and emergency response that occurs in the American healthcare system. So for example, after a hurricane down in Puerto Rico, the VA is there to help serve. And so what I loved about my time in the VA and the opportunities in the VA, and what I take away even from my journey there today, and being on the corporate side, is that really to do work at scale, and VA is at scale, right? You can't get a larger healthcare system in the United States, all 50 states, 3 international territories. You have a large span of control and a large span of delivering care to veterans in the United States. When you get to that level of scale, it really does require the best partnerships to be able to deliver on that at the scale that you need to deliver it. And it's no different in my role here at United Healthcare. When we're working across the entire United States or even across the globe, it really does require that collaborative effort and that partnership to be able to deliver what we need to deliver to our members at scale. And the partners you mentioned, whether they're big partners or small partners or startups, what we know about the innovation space especially is that it doesn't matter if you're a startup that you started up out of your garage, as one of the panelists is here today from Microsoft, or if you're a startup in the healthcare space that's being funded by one of these larger companies, or if you're a smaller company working with a larger company. I think there's just many meaningful partnerships that we see. And the amazing way that the VA really brings all these folks together to be able to deliver healthcare and services to veterans in the United States. It was my honor and privilege to serve in my roles in the VA when I did. And it's, of course, my honor and privilege to come back and talk about United, as well as champion and continue to champion the work that the VA continues to do.
So thank you so much. And I will tell you, one of the interesting things when I was the CIO for Navy Medicine is that folks would come in and I'd say, well, how big of a system have you done this for? Well, I did it for 4 hospitals. Well, that's great. How are you with 1,132 sites in 43 countries with deployed ships and 241 ships and submarines? How do you do with that? And their face would kind of explode in front of me and they'd say, well, I have no idea. So this is where having that partnership and understanding at scale becomes important. So let me throw it over to our veteran, our Air Force nurse. And thank you for the work that you've done and your service as a veteran. And by the way, to all veterans that are watching, the VA is composed of veterans, and I know that the 4 groups that are with us hire veterans. I salute you, and I salute all those that take care of our veterans. That's the mission, and it's the goal of what we're doing. So tell us what AMVET is doing, and your work with suicides on vets is one of the areas that you've focused on. So tell us about that. You're on mute.
Thank you so much. Yes, I am the current Chief Medical Executive of AMVETS, and one of the key initiatives we have currently is around veteran suicide. And so for me, as a nurse, I see it, and I saw it while I was taking care of troops at Walter Reed. I saw it downrange in Iraq and Afghanistan. So it's important for me, as I manage the HEAL program, where we heal veterans where we are, that we have partners that can help us. This is not just a one-person initiative where we get to save lives by ourselves. It's the partners that help us do this. And one of our partners, of course, is the VA, who actually sends a lot of their veterans to us, our HEAL program, to help them. Our suicide prevention program is currently an online program where you get to go through different scenarios to help you have that conversation about suicide. And what we have found is that a lot of people don't want to have that conversation about suicide. They don't want to say that word suicide. But once you get past that, you have that window of opportunity to save lives. And we were so excited to be given $20,000 by the Christopher Reeves Foundation to expand as well as upgrade our version 1 of our online suicide prevention program, which is taking the AMVETS Post by storm. Everyone is taking it. They are enjoying the scenarios. We have a lot of our AMVET members reach out to us for postvention when they've lost a member and asked us to come and support them as they're getting past the grieving process. And as a result, AMVETS has allowed the HEAL team to actually become assist trainers. And for those people who are out there, know Assist in Living Works, that provide an online suicide prevention program as well as face-to-face interaction for suicide prevention. We are now assist trainers, and not a lot of VSOs have assist trainers out here. So when veterans are in need, they are thinking about taking their lives, they call AMVETS, they call the HEAL program, they call the HEAL team, and we're equipped to be able to save lives. So we're very, very proud of what we're doing in the area of veteran suicide, and having partners like the VA, having partners like True Genomics, having partners like Military Hire, and the list goes on and on and on, that support in our efforts.
So thank you so much for that. And Jay, I'm going to bat this one over to you because you work with Medicare and Medicaid, and you've actually done a lot of predictive analysis on health, so kind of predicting outcomes and doing some innovations around that to do predictive health modeling. And one of the things we know with suicide is there are constantly programs that are coming in to try and predict which veteran's going to be at risk, which factors are there that we can look at, whether it's their spending patterns, their credit card debits, spousal abuse, or drinking. We know that they're predictive indicators, and a lot of the new innovations come in to work on that. But Jay, you've been able to take those as a provider and use the Medicare Medicaid proponent on that. How do you bring that into innovation, and how do you see bringing that back and taking those innovations forward as a partner? Jay, you're on mute.
Can you hear me now?
We can.
All right, perfect. Thanks, Joe. And it's a pleasure to be with all of you, and just appreciate being on this panel with folks that are working every day to make lives for veterans better. And, you know, for me, my journey started as a med student and as a geriatric fellow in the VA at the University of Michigan and the Michigan VA. And so working in the geriatrics and extended care center really gave me a window into the possibility and opportunity for innovation in the VA. So, you know, for one of the areas that we think a lot about is how do we get out in front of issues and use analytics to try to scale and drive innovation. And so one of the areas that I've worked on when my time at the American Hospital Association and am doing now with the Medicaid ACO and a Medicare Advantage plan is thinking about this notion of an age-friendly health system. And we worked with the John A. Hartford Foundation and the Institute for Healthcare Improvement. And it says, well, you know, what's the main thing is the main thing is the main thing. And it turns out that when you look at the data of all these factors, 13 discrete things matter in the care of older adults. And when you look at those issues, you can bucket them into 4 areas: mentation, mobility, medication management, and what matters to you, which is really about patient and family preferences. So those 4 issues addressed in a bundle, deployed reliably, can actually predict outcomes and situations where you can improve outcomes and lower cost. And so we started, you know, thinking about this in a pilot group. And the interesting thing here is when you think about innovation and scale, it's all important thinking about who your initial partners are, you know, in terms of success and wins, but also can you get to scale easily with those partners over time? And then having the agility and adaptability with driving that forward. So we picked Kaiser, Providence, Ascension, Trinity, which are large health systems, and then Anne Arundel. And so started with 26 pilot sites, which is now over 600. And what we're finding is that these 4 factors matter in terms of improving the care for older adults. And when we see fragmented systems, it's a challenge. And so we're just seeing immense opportunity. And what'll be nice for this community to know is that the Center for Health Equity Research and Promotion at Philadelphia's Crescents VA Medical Center just received some resources from the VA Quality Enhancement Research Initiative for implementation of age-friendly concepts throughout 54 VA health facilities across Pennsylvania. And we went from 26 sites in pilot, inpatient, post-acute, ambulatory, to now over 600 across the country. And it's great to see the VA driving this forward.
That's outstanding. And we're gonna, you know, you've got United Healthcare and Microsoft on this panel, 2 small startups that, you know, are just now getting their feet on the ground. But Jessica, we're gonna throw this over to you. One of the things that becomes important, Jay, with what you said is that when you innovate, you have to run a pilot. You have to see how it goes. You wanna try it. You wanna see if people have acceptance. And then you have to be able to go to scale. And you have to be able to see if that's something that you can take across. And a lot of times you need a big partner like a Microsoft, like a United Healthcare that has that vast reach. Jessica, what have you seen in your role with innovation, and whether it's a CRADA or a cooperative endeavor agreement, or how did you see the role of industry versus the role of internal on coming together?
Sure, certainly. And you've actually, and first of all, thank you, Joe, for including me as part of this panel. I did want to just clarify, it's actually pronounced Microsoft. You know, it's a small company. Most people don't know about it, but I just wanted to make sure. I'm kidding, of course. So, but, you know, there are several different types of agreements that we've used. You know, Microsoft, we obviously you know, have been a strategic partner with the VA for over 20 years. And there have been numerous ways that we've been able to establish partnerships in order to build more together that kind of go outside those traditional, you know, traditional contracting scope. The two I'm going to really talk about today are the first one is an MOU or memorandum of understanding. This is typically like a letter of intent. We use this, we donated a bunch of Xbox adaptive controllers, which we created out of a Microsoft hackathon and we donated a lot of those across VHA to all the different facilities to help with veterans for their rehab, but also just from a, having fun perspective in that social environment. So this was a pretty easy, it was just a donation. So this was something that we were able to just establish the MOU, basically, that just said this is not connected with a sales opportunity. This, it's basically a non-standard agreement. We didn't have to get too many groups involved because it was just traditionally, we're going to donate these devices in order to support the mission. And so these are typically non-binding contracts, and just kind of this just kind of lays out the framework of this is what Microsoft is going to do. We're going to donate these Xbox controllers, and then this is what the VA is going to do, and just kind of outline that kind of agreement. On the other, so for things that are simple, I recommend, going for an MOU, a letter of intent, because that's just a single document and pretty easy to draft. On the other hand, we have also been working, and I'm sure we'll talk about this a little bit later, on Project Convergence, which is a partnership between Verizon, Microsoft, Metavis, the VA in Palo Alto, and the VA National Center for Collaborative Healthcare Innovation. And so this is bringing a lot of different large companies, large organizations together that all have different pieces and different parts in order to build the pilot and build these types of solutions. And so for this, we had to go with a CRADA, which stands for Cooperative Research and Development Agreement. This requires a lot more people to be engaged. We had to have our contracts, we had to have our legal, we had to have our sales team, we had to have our product groups, because we were donating our HoloLens, which actually, before it actually even was available, we were providing these to the VA. So we had to get a lot of different people to review all of the terms and conditions, as did Verizon, as did Metavis, as did the VA. So the cool thing about a CRADA is it's really focused on research and development in any type of area that is focused on, the betterment of that agency and focused on that mission. So if you're doing some sort of, really innovative project, you'll see this coming out of a lot of the Department of Energy labs. They do a lot of CRADAs. NOAA does a lot of CRADAs, and any type of agency where they are, really just doing something transformational, really focused on R&D to be able to further the mission. And so for that one, we had to go with the CRADA. One other piece about the CRADA and why everything has to be, all the T's have to be crossed and all the I's need to be dotted, is because this actually does go in front of Congress. So Congress will also, take a look at the different CRADAs and understand, okay, this is what is, going forth, and they have an opportunity to take a look at that to make sure that, it is going for the betterment of the mission.
So you said a couple of interesting things. It's always fun when you talk to the VA and you say, so who's your boss? Well, it's about 535 people there that sit over just a little ways from here, which is always fun to answer to Congress. And they have different budget lines for each of the VA organizations. But to set a stage of what's going on in the VA here, you've got EHRM, one of the largest electronic medical record replacements in the world. You have FMBT, the big financial reorganization. You have HR Smart, the big HR transformation. You have Valor, or DIMLS, being brought in, the big transformation of supply chain. So all these initiatives going on, all these big companies that are running these, from CGI and IBM and Cerner and Leidos and all of these guys that are pulling this together. And the question that comes in is, yeah, but what about the small companies? How does a small company get a CRADA? How do I come in if I don't have those relationships with a Cerner or with a Microsoft or with an IBM or with the CGI? How does the small guy get involved? Now, Saurabh, you were in there, and I'm sure you had a whole bunch of SDVOSBs that came and talked to you. And I know our nurse is an SDVOSB working in there. So what would you say to the small companies trying to do what you've just done? Because that's a real minefield there. Saurabh, you want to take a stab at that one first, and then Therese?
Yeah, I'll start off with that. And it's very important to make sure that, the size of the company is important, but also what skill sets that they're bringing that are complementary to the work. So, for example, AMVETS, it brings a knowledge and an integral knowledge of what veterans are really seeking and what veterans are really wanting in their day-to-day life. So, thinking about really the skill sets that you need, whether it's a large company or a small company or a mid-sized company, think about what those skill sets are and bringing
Intimacy
them
to the
together
mission.
to be able.
Intimacy to the mission is what you're kind of talking about there. Understanding the actual issue, the
Exactly.
problems, the intimacy of the problem at hand.
That is exactly the point. So how are you able to better understand what the core needs? And we spent a lot of time in the innovation ecosystem to be talking about human-centered design or design thinking. So what are the true problems we're trying to solve? And really, when you bring in some of these companies of all different sizes, especially some of the smaller companies that have more intimate knowledge of the problems at hand, or the consumers, which in our case is, or in the VA's case is the veteran stakeholders, then that intimacy is quite important. And then the other part is there's many different forums for these smaller and larger companies to come together and do a lot of these partnerships and start thinking about where they can partner. I'd say, when I was on the inside of the VA, I always noticed that there was great opportunities for these companies to come together, such as the event that we're here at today. We're on year 5 of spreading the innovation ecosystem in the VA, and it's grown substantially over the last 5 years. So I was actually just texting with another colleague about this 5-year anniversary of thinking about innovation, and specifically what the awesome team at the innovation ecosystem has grown over the last several years. And one of the amazing opportunities is events like this. Now, of course, previously when we've been in person at the National Press Club, it's a lot more easily attainable to make some of these partnerships and make some of these connections. But what many folks don't realize is federal agencies also are playing a significant role in really driving innovation and really driving where those discussions around innovation were occurring. And the secretaries at the VA that I had a chance to work with in my time at the VA, they all both did a great job in terms of bringing together those types of large and small public and private partnerships, bringing them all to the same room and say, hey, this is the problem we really need to solve for Veterans Health Administration. How can you work together to help solve this problem? So in addition to the companies themselves, which we do a lot of collaborative work with small partners and big partners and finding those networks ourselves, the federal agencies, I'd say, also do a wonderful job of bringing together those types of convening areas, such as what we're doing today and tomorrow, for these types of interactions to occur and really drive and work towards how do we solve this problem together and collaboratively.
So I just want you to know that feeling of when you're here and you're networking, everybody is about 60 feet away from me. I'm on a stage by myself. There are camera crews with masks on them. So I've got my COVID beard that I think makes me look like Sean Connery in Hunt for Red October, instead of the clean-shaven Captain Grace. Now I get to be Sean Connery, But my point is, you have no idea what anybody looks like here, so it's okay. We're good. We're good. Teresa, you were going to say something there.
Yeah, I was going to just piggyback off what he said, particularly for AMVETS. I mean, we have a pulse on the veterans, right? So a lot of the partners that come to us, they could be small companies, they could be big companies. And one of the first things that we do in particular is making sure that their vision and their mission aligns with ours. Because if it doesn't, it's not a good fit. It's not a good partnership. And I think it's important when you're thinking about veterans and saving veterans' lives. I know for us, in particular, our partnership with H-Wave has been one of those profound partners because they align with our mission and our vision, just like the VA, of course. And I think it's important that big or small, as long as the vision aligns, the mission aligns, we're after the same thing. we can all be in the trenches together and we can work towards that common goal. If there isn't a common goal, again, I go back to that fit. It's just not a fit and we can't make it happen. And I think it's important that you, before you dive into an MOU or a crater, you have to make sure all of the people at the table are those ones that are after the same mission and the same goals.
Yeah, and Jay, I want to throw this one up to you there. We've talked about aligning with the mission, and we've talked about the internals there, and we've talked about CRADAs and memorandums of understanding. So the question I'm going to throw to you is that in all of these initiatives, you're working up there with the Center for Medicaid and Medicare, and you're working, you know, the VA is a big beast. And then you've got the Department of Defense and the Defense Health Agency. That's a big beast. And then you have all of the commercial hospitals, the Kaisers, the MD Andersons, you know, they're all big healthcare systems, but we all come under HHS, and CMS drives a lot of this. How do you see these partnerships and innovation crossing from agency to agency? And is that innovation partnership working? How do you see those brought back and forth across, Jay?
So, you know, I think that it just builds on what my co-panelists have said. Alignment around vision and mission is table stakes, and shared understanding of the problem in a way that there's alignment around what problems needs to be solved is also important, because you could have people with different perspectives on how to address the problem, and also think that there's, you know, 10 different problems if you have 10 different people. So I think that it's really important to spend some time up front saying, are we together on solving, whether it's behavioral health, which we know, you know, you're not going to compete on, but you can actually make a huge difference together on that issue. And so I think it goes back also to the point that Saar made about skill sets. You know, what are the different skill sets? Who can advance quicker in a particular area, more so than others may? Because this piece about smaller organizations, or, you know, you create, I think, a sandbox that moves forward a bias for action and adaptability and agility. And so that allows that space to happen. At the VA, it was the VHA ecosystem. At CMS, it's CMMI. At HHS, it's giving people recognition and some resources to actually sprout something that could then scale. And, you know, the private sector, it's actually been really interesting in my work with the American Hospital Association as Chief Medical Officer. We've worked with Microsoft, we've worked with the VA, we've worked with other large organizations and smaller organizations. And even in my role now with Medical Home Network, it's, you know, we're working with large and small organizations, but I will say this, you know, on the age-friendly health system, the reason why so many people could come around that is because the 4 M's are simple to understand. Executives can understand it, frontline folks can understand it, other members of the team can understand mentation, mobility, medication management, what matters. So it's also framing it in a way that allows people to come together. And then it's an aim, you know, 20% of hospitals that are age-friendly by 2020. So, you know, you have aims create systems, and systems create results. And that's what the work with CMS and the Hospital Improvement Innovation Network and other examples like that have helped us move forward. And so I think it's also having a space for learning and then rapidly iterating those learnings into action. So this bias for learning and action, you know, is critically foundational.
Right, right. So Jessica, I'm going to throw this one over to you. One of the favorite expressions that I like to use is that when an innovation comes in or a new technology comes in, they always say, look, this is the greatest thing in the world, and look what we can do. Everybody wants one. Well, I always do a self-check, and I don't know that I want that, but okay, let's at least look at it, right? And my team in my company would laugh because I always say this. It's Christmas morning. I crawl down under the tree, and there's a present, and it's labeled Microsoft, or it's labeled United, or it's labeled XYZ Innovation. And when you open it up, it says, some assembly required, batteries not included. And so there's a whole bunch of work that has to be done by the VA, by the organization, whether it's an ATO, an authority to operate, whether it's their security, whether it's the fact that you could never run that medical device on your network, it's made in China. You pick whatever the scenario is, but some assembly required, batteries not included, you end up playing with the box. How have you gone through those policies that seem archaic, written by those 535 people, rules to protect the dollar, protect the government? How do you find navigating through that, some assembly required, and what have you done or found that when you bring that forward early, does that help in your partnership, knowing what their level of effort's going to be? Maybe you all could address that concept.
Sure. So very good question, and something, whenever you're working with the government, VA has extra complexities with, HIPAA and healthcare and PHI, and all of that. So, but, any government agency, you have to deal with FSMA, which is now FedRAMP, and, getting that ATO, being able to go through, TIC, trusted internet connection. And there's just so many NARA rules, records management. I mean, there's so many different things. And the intent of all of these different rules, policies, regulations are good. But with the advent of the cloud and the way that technology has really changed, and, this has really been, the last decade or so, what was important in the past, or the way that, rules and laws and regulations that were, written in the past of, hey, I want to be able to touch that server and be able to take that with me. With the advent of the cloud, that's just not possible anymore. And so, I think being able to really talk openly about, policies and these things that some are archaic. I mean, there was FSMA, which is, really focused on making sure everything is secure and we're meeting privacy and all of that, has transitioned into FedRAMP. And so Microsoft, as well as all of the cloud providers, have, worked with the FedRAMP organization to be able to have these ATOs, to be able to have these controls set in place, so that when we go, when the VA or any other agency is moving to the cloud, we already have had this stuff in place, and we can bring our learnings, because at the end of the day, government knows their mission the best, and we can do what we can to support it, but we know technology and how the controls and all of those things kind of mesh together in order to meet a compliance solution. And so, it really is indicative of a true partnership. You got to take the requirements from the VA and what they know and everything, and then how technology can enable that. You think of technology as an enabler of their mission, but it's really a partnership of us working together with the VA in order to deliver a true end-to-end solution that, at the end of the day, is going to help improve benefits to veterans.
Well, we're just glad that we had Joni Mitchell early in the 70s so that we can look at cloud from both sides now and understand both the industry and the VA side, right? Teresa, you as a veteran, so a question came in, as a veteran, going now from one side of that equation to the other, both sides now, how is working as a team helping with the outcome? And how is it now working as a veteran coming back into the VA in these innovative partnerships? So how does that work for you, and how do you feel about that?
Yeah, I think it's number one, it's a good question. And number two, it's about how we transition as veterans. And I know for me, I had no idea I would be in this space. It was the furthest thing from my mind that I wanted to be in this space, because I heard the VA was going to be a beast. And even when I became the chief medical executive of AMVETS, I'm like, oh my God, I really have to learn the VA, because I'm gonna be there all the time and helping with solutions and saving the lives of veterans. So I think it's important that, number one, you have to know what you're going to tackle. And I knew I needed to tackle this type of challenge. And number two, just knowing that the end goal is saving the lives of veterans and bettering the lives of veterans. And so whatever homework I needed to do, whatever communications I need to have with key people at the VA, I made those things happen. It's all about networking and connecting with the right people so that you can get the solutions that's necessary for the veterans to live their best lives. And I think for me, it was just making sure that I felt like I had enough expertise and I was confident in my skill set to be able to walk into the VA and advocate on behalf of a veteran, to advocate on behalf of AMVETS. And I think that's key for anybody that's looking to pursue something like this is you build up, your confidence in knowing what your overall goal and your mission and your vision is, as well as your passion. And if your passion is for veterans, then if it means tackling the beast of the VA, tackling the beast of the VHA, then that means that's what has to happen. And I think I've been at AMVETS for almost 2 years now, and I've met everybody all the way up to the secretary. And I have no issues with, bringing problems or bringing solutions to the forefront, because I think at the end of the day, I want to sleep every night knowing that I gave it 100% every time I'm advocating for a veteran. So it was trying, but I think I knew I had to overcome it. And I will encourage any veteran looking to come into the VA system and any partner looking to be a partner with the VA that is going to be a beast. And you just got to, take baby steps and conquer it all.
Right. So one of the questions that came in, I'm going to throw this open to everybody here, is as a veteran, as a fellow veteran, the question comes down to, well, how do I get to know the people that are on this screen? I want to know them. I want to know the Microsoft girl. She seems like she would like to give me some money to help my company succeed. I want to know the United Healthcare guy or Jay, and so there's Kingdomware that allows service-disabled veteran-owned companies to have first priority on business. But a small company that doesn't have what we call the contract vehicles of SOUP or T4NG or Oasis or Vector, all the names of those contract vehicles, because you have to buy something in innovation. How do you see the partnerships with United, with Microsoft, Jay, with your group, Sharice with AMVETS? How do these small guys get to you in a partnership? How do they get to know you? Break. How do they get to know the Ryan Vegas of the world, the Carolyn Clancy's of the world, the Dr. Liebermans of the world, the Pam Powers of the world, and are those even the people they should be talking to? So in your experience of this partnership, how would you suggest these innovators navigate these waters of sharks? You want to take that one, Jessica? You
Sure.
raised your hand, so I'm going to go with you.
Okay, great. So I would say Microsoft would not be where we are today without our partners. And we are a very partner-focused organization, especially, and we're also very focused on, SDVOs, SDVOSBs, whenever we can partner with either a small business or a veteran-owned business. I mean, that is just better for everyone, and we embrace that. I think Sharice had mentioned something earlier. It's making sure we come together with the right skill sets and that we, we're able to fill pieces of a puzzle together to be able to deliver the right solution for the VA. But I would say, Microsoft isn't a scary place. There are, we have thousands and thousands of partners. We have an extensive partner program. We have training for we have the ability to get to know, what it means to be a partner, just by going to our Microsoft.com WAC partners website.
But what's great is that you've said you were going to actually give out your phone number and home address to everybody that wanted to talk to you. And we'll put that up at the end of this just so we know, so that they know how to call you directly. But getting through those wickets, that's, we got all this stuff, but in one sentence, who would they call? Who's your Ghostbusters?
You can email me at jesstab@microsoft.com.
There you go. Surratt.
And I
was
go
ahead, Jay.
Build on, I think what Jessica says is spot on. And you can reach me at jay@drjbot.com. And I'm happy to chat. One of the things that I've seen work is small firms and large firms create an open platform upon which to invite innovation collaboration from startups or emerging players. And so I think there can be a really interesting opportunity where you create space to bring folks together. So you may have these organizations or companies or individuals, Joe, that you're talking about, create a space by which they can invite a number of larger or medium-sized or smaller organizations, to have a conversation. You can do it through open architectures, APIs, microservices. And I think what it speaks to, and this real important issue of being relational rather than transactional, because the value in ecosystem, that an enterprise can create within an ecosystem is directly proportional to how well the relationships are managed. A successful relationship requires trust, transparency, sharing of benefits, as well as being effective at operationalizing the relationship in a way that feels good to that
Right.
group. And so I think that that can make a real difference.
Absolutely. And you said something really important there that as the folks come in to innovate and they reach out to you and find out that ecosystem, getting through to you all, it becomes important. So I was recently moderating Paul Lawrence from VBA, shifting off of VHA, and he said, what we really need is the big companies to reach out and give those small companies a chance to come in. So to bring them in, kind of like sheltering them and bringing them into that innovation, because they've got the contracts and they have that access. And so I acknowledge you all for doing that, because you're each in a big ecosystem there managing those big programs. We had another question. I want to pivot a little bit here. The question is, how have your organizations pivoted in innovation because of COVID? So have you shifted your innovation methodology, or you've brought things in faster? Did you accelerate going to production? How's that affected you during the pandemic in the innovation partnership access?
So I could start with that one and say that a lot of what actually is occurring in the VHA as well. So thinking about a learning health system and how do you pivot your healthcare operations into a learning health system, there's this cycle of a learning health system that I'm sure many of you are familiar with, especially our VHA listeners. And what really happened during COVID-19, and I've seen this happen also with our partnerships, is that cycle has become faster and faster. So during the last several months, we'd maybe have an innovation cycle that would go over a period of weeks or months, or maybe a 6-month innovation cycle. Those innovation cycles reduced to maybe days or weeks, especially in the early days of the pandemic. And also our ability to find partners and our ability to collaborate with partners also accelerated at the same pace as we were thinking about how to work on new solutions, whether it's delivering technology, scaling telehealth, overnight, working with more and more providers' offices, thinking about our large provider networks and a lot of our partners in the provider space, and thinking about how we shift healthcare and allow them to shift healthcare for our members from in hospital or in clinic to maybe in home care during those early days of COVID-19. And now, as hospital systems and clinics across the United States are a little bit more available and ready to receive patients, how do we now start getting patients back into hospital systems and clinics in a safe manner, especially for a lot of the preventative services that may have been avoided, such as colon cancer screenings or breast cancer screenings over the last several months. So those are the types of things I'd say this pandemic, it's not that it changed our ability to innovate. I would say we were always innovative in many diverse ways, whether it was on the provider side, the payer side, where we partner with VHA and Optum Community Care, or whether we partner with VHA in other ways. There's many ways we were already working. I'd say what really happened over the last 6 to 9 months is that learning health system cycle really accelerated and became shorter and shorter, and we got through a lot more iterations. So when you talk about innovation and rapid cycle learning, we did a lot more rapid cycle learning.
So how much do you all feel you had to go in and dig? The business development lead for a company is always trying to gather information. It's like being a spy going out to find out what's going on. How wonderful would it be if they said, we're struggling with the following 5 things. We're struggling with the following 10 things. Hey, we haven't figured these 5 things out. Do you find that you're getting that kind of information so that you can innovate to that? Or do you feel like you're constantly pounding on the outside as a partner? How does that play out for each of you?
I would say, Joe, for me, it's probably a mix of both of those things. I think that, one thing which COVID-19 has done is for those organizations in which innovation is routine and part of your DNA, it's created more opportunity. And for those places where innovation is not routine or part of your DNA, it's really created a wake-up call that it needs to be. And so, one of the opportunities we see is that because people are searching for urgent partners to scale or to take action that has bigger impact. So in times of crisis, more urgent action includes adapting the core to meet the shifting needs of who you're serving. And so you were performing, and some may have been transforming, but now everyone feels like they need to perform and transform at the same time.
Right.
And then identify new opportunity areas. So new partners emerge because of these new opportunity areas that are created by the changing landscape, and then reevaluating your core business and your risks that you're going to take. And so some risks that you might not have taken with partners, because there's some partners that may not be ones that you could move forward with right now, but you might go out there and take those risks, and then building a foundation for kind of post COVID growth in order to remain relevant and in the next normal. And so I think that that's what we've seen, is that we've had to maybe ask different questions of partners as a result of this, and understanding what the capabilities are and what they're willing to do and what they're not willing to do during this time and beyond.
Well, I thought it was fascinating, and I love the American innovation that we immediately had face masks made with your own picture on it, or we had face shields that were had all sorts of designer diamonds on them with face shields, and we had temperatures that would read people's temperatures, but that actually then played video and did advertising at the same time it read your temperature. So the American innovation is always happening there, which is really interesting and exciting. But to your point, how do you bring those to bear, the ones that actually move the needle and make a difference in doing that? So in the partnerships, I'm going to ask the question that I asked the other panel, and that is, how much as a partner does policy, rule, procedure, always done that, get in the way of innovation? But let's spin it to a positive. How do you remove barriers so that you can be successful? And what have you done as a partner to be able to move around that? Whether it's, I'm a big company, I can work with the congressional delegations to change some of the rules or laws, or, hey, we're good, we can help you with that ATO because it really doesn't make sense, or talking to the CIO that maybe that doesn't make sense, or the head of medicine. How have you moved the roadblocks, and what would you recommend in partnership to get past those? Policy, procedure, law, rule that stops innovation. Yeah, Sharissa.
I will take that one, particularly for someone like myself who's a veteran. That's all about policy and procedures and regulations. I mean, that's how I went through the military, and that's how I learned to do things, is by policies and procedures and regulations. Being a member of AMVETS and being in the role that I have, it's important that I'm always looking at those policies and procedures and regulations to make sure when we're bringing on a partner that they are aligning with what the organization is all about. Because the last thing we want to do is bring someone on and then we're breaking our policies and our procedures. So if it's something that's archaic, and I've had to challenge this several times with the organization, if it's something that we need to update, if there's a policy and procedure that needs to be changed, I think in the executive role that I have and my expertise, I'm able to bring that to the table and say, hey, can we change this to adapt to what we're dealing with? A lot of policies and procedures, if no one has updated them, they're probably so old, it's not even relevant to some of the things that the veterans are dealing with right now. So being open-minded in the organization to say, let's take a look at those policies and procedures before we bring on a partner, so everyone is on the same page when it's time to create that memorandum of understanding, and that partnership is important. But even though there may be policy and procedures out there, we should not let that be a barrier to have partners come on board, particularly with AMVETS. We have so many organizations coming to us because we have the pulse of veterans. We have so many posts across the country that they want to tap into that veteran community. And we welcome those conversations, and we put on the table, here is what AMVETS is all about. And if they can't comply to those rules and regulations and our policies, we will sit there and still engage them. But if it's not something that we can pursue, we still put it as an opportunity to teach them and mentor them if they're trying to get into the veteran space. So we don't see it as an opportunity to say, no, we're not dealing with them. We see it as an opportunity to educate. So if they do pursue further, they know how to deal with veteran service organizations and they know how to deal with veterans. And if they want you to pursue the VA, they know how to pursue the VA. So barriers could be an educational solution to a lot of companies that come to us, but we don't see that as a means to break our policies and our procedures and our regulations.
So we have 2 minutes left, 4 of you. By my math, that's 30 seconds each. What I want to do is go round the horn. It's your epitaph. It's the last thing you get to say in the world about innovation and partnership. This is your chance to leave your mark on the planet. So I'm going to start in Hollywood Squares in my upper left. Jay, 30 seconds.
So, well, I'll start with where I started earlier. Being an age-friendly health system means that everyone involved in the healthcare of older adults, from the person who cleans the room or greets you at the desk, the nurses, the doctors, the therapists, everybody understands what is important to you as an individual. And that as we get older, or we engage in various activities related to innovation, we think about what we value are different things, and that what matters most to one partner maybe what is different than what matters to another partner. And so starting with that alignment about what is the problem we're trying to solve, and not a symptom, the problem we're trying to solve, and alignment around, the values that are shared, I think can help unlock innovation moving forward. I'm just grateful to be here with all of you.
All right, I'm going to go to upper right, Jessica.
Thank you. I think we're really at a transformational point in healthcare, and, all of the innovations, artificial intelligence, the cloud, all of these things are coming together and are really transforming the healthcare of the future. I did want to just talk about a quick project that we're doing out in Palo Alto, which takes actual HoloLens. It's taking our HoloLens technology and being able to take 3D images and transpose them on, being able to take 3D imaging and being able to transform into a holographic lens. So, I mean, the future of healthcare is today, and we're just getting started. And I'm so excited to see VA leading the way with everything that they do. And thank you to the VA and all of our veterans for everything that you do. I mean, we owe so much to all of you. And that's why, we at Microsoft are so committed to supporting VA's mission.
Microsoft.
Sorry, I always
All right.
forget.
Sarab, over to you, sir.
Thank you so much for having me. And again, thanks for the mission. I'd say what is really important as we are thinking about innovation today and tomorrow is don't think about a big company or a small company as a positive or a negative. It's really about what people bring to the table to go solve that problem that you need to solve around your innovation challenge. And what was just mentioned a few moments ago, thinking about policies and procedures, it's not that policies and procedures are wrong. It's maybe that they just need to be changed and evolved. So as you're thinking about an innovation ecosystem across the entire United States, a healthcare system that's across the entire United States, think about what assets you have internally, and then also where public-private partnerships can really play a role in helping you deliver that healthcare delivery system of the future, because we know it's going to be more technology, more in-home care, more resilient care, smarter employees, smarter patients. And so how do we really bring all those different elements of innovation and healthcare together? And we know that innovation journey for the VA, especially as they do this healthcare modernization, is just starting for the next decade to evolve and continue to grow. So I'm excited to see the future of that as well.
Teresa, and I want to again, I want to acknowledge the veterans that Jessica talked about. We're going to leave this to our veteran Air Force nurse to close us out on this panel. No pressure at all, but the whole VHA's innovation success hinges on the next 30 seconds of enlightenment.
Awesome. Well, I would like to say first and foremost, I'm so happy to be here with the rest of the panelists and particularly the partnership that we have with the VA. I would say and urge everyone, innovation is not bad. Be receptive to innovation. It's changing lives. I've seen what has happened and what it's done to soldiers on the battlefield and coming to Walter Reed. And it's because of innovation that we're saving lives and these guys are able to live their best life is because of innovation. So when the new things come out, be receptive, be willing to just listen to what's out there and be willing to change if necessary, if it's going to save the lives of our veterans. And I think that's the biggest takeaway. Just be receptive to innovation because it does save lives.
So I just want to thank this panel. You guys have been great, and it's always interesting to try and do this in a Zoom fashion, in a Teams fashion, and batting back and forth. You truly can't interrupt anybody because you haven't got a mute button, and it makes it really fun. But thank you for your thoughts on innovation. Thank you for the words of wisdom that you've brought in, and just